started.
We're ready. You guys jumping in.
Got this. Guys, we are so tired.
The lighting's good though.
The lighting is actually
very good, right? Is it the blue? Is it the bouncing? Because obviously it's not the fluorescent light.
It's definitely not the fluorescent.
I can work those out. No, it's good. It's really good. Now, when the screen is sideways like this, can you see things like people comments or people jumping in?
Yeah.
All right, cool. Well, we're doing this here in the private group because this is going to be a treat. Just joining us for a regular Q&A here at the New York Baby Show.
I'm finishing my pouch of nourishment because I haven't had any food all day.
Like an astronaut, right? Pouches of food. That actually looks like a good idea. Carrying those around. What is it?
Once Upon a Farm. Once Upon a Farm. I'm a huge fan. It's Jennifer Garner's baby food company. And it's delicious. It's all cold and yummy. Drop pouch.
Are you live?
Yes.
In my group. In the group.
Is this on? Okay. So if you want, Shari Criso and I are going to be hanging out in the little even floor booth that could. And we're going to be talking about breastfeeding and pumping. We have a prize, apparently. I did not know about this. That's exciting. Somebody's going to win something. I already gave away my dignity. So, yeah. Shari, I will let you introduce yourself as soon as they're done making a speech. You never know what they're saying up there. But I'm going to talk louder than them. It's very sensible.
Hi everyone. So happy to be here for our second day of New York Baby. So glad to see you guys. Come just join us. We're going to be doing a Q&A.
We need a triangle and a bell.
Yeah,
like, ding,
ring the bell.
Ding, 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 ding.
Come on over. Anyway, I'm Shari Criso. I am a registered nurse and a nurse midwife and a lactation consultant. And I've been working with Even Flow for many years. I help them with their advanced double electric breast pump, which is here on the table, to design it with features that really work for you as a mom, a pumping mom. And I've been working with this guy over here for
almost 10 years.
Almost 10 years that we've been doing basically this together for 10 years. But we're here to answer questions today and talk about the most basic things that you need to know for breastfeeding and for pumping. And I see some of you guys that were over at our other talk earlier, and so hopefully you have some stuff you want to ask me. And Jamie too.
Yeah.
It's fun doing 2 seminars a day, isn't it?
Of course, it's fun. Very fun. Question? Oh, we have a question.
If I'm a breastfeeding mom and I know I'm going back to work, when do I know when I start pumping? How often? How do I prepare to go back to work to be successful?
The question about when do I start pumping? How do I know what to pump? How do I know how to get prepared to go back to work? Here in this country, of course, so many of us need to be working and breastfeeding at the same time. And so it's really important to make sure that you're preparing yourself for that. I think the first thing to prepare for is making sure that you get off to the right start with breastfeeding, but that you also quickly think about introducing your baby to a bottle and to your body to the pump, so that you're not thinking about it the day before you're supposed to go back. I get these calls of like, I'm going back on Monday, what am I supposed to do? It's Saturday. Baby won't take a bottle, and you're panicked. Introducing the baby to the bottle earlier with a little bit of pumped milk, making sure the baby consistently takes it every day till you go back will make life a lot easier for everyone. And also planning ahead for how much milk you're gonna need just for that first day back. You know, you think, oh, I gotta go buy like an extra freezer and like store all this milk. Like to go back to work, I have to have, you know, bottles and bottles and bags filled in the freezer, right? Ice cream. But you don't. What you need is that first day back. So enough milk for the number of feedings that you may miss when you're gone through maybe that first day at a minimum. And then when you are at work, you're going to pump that extra milk that you're going to leave for your baby the next day. So getting ready early, and I think one of the questions that came up earlier was like, how much does a baby eat? Like, how much do I leave?
Yeah, that always.
I think a lot of people actually, because when you go to the store and you see like this wall of bottles, they have no idea how much a baby actually eats because you see 9-ounce bottles and all this stuff, and that's not what a baby eats until later if they're formula fed. So I think there's like no information out there on like the stomach size, how much to eat, whatever. And when I was taking breastfeeding classes where I used to work, that was actually the thing that shocked me the most, was how tiny a baby's stomach is. I have no voice anymore.
Well, how tiny the baby's stomach is, how little a breastfed baby actually eats because the milk is changing over time. So, you know, somewhere up to about 4 ounces, maybe 5 is the max that a baby's going to eat out of feeding, even as they hit a year old, you know, throughout the entire year. So this becomes a big problem when parents may be putting their child into a daycare setting. And most of the babies are feeding formula, eating formula at daycare. And they're used to seeing these giant bottles, and they're giving the baby the bottle, and the baby may be crying after a few ounces because the baby wants to be held, or the baby needs to be burped, or the baby needs that, you know, maybe missing mom. There's other reasons why babies cry. And quite often the babies are fed all the milk that the mom needs for the day, and mom's told, you know, I need to make more. And obviously they can't because moms make what they make. Moms make what they make. So what Jamie was referring to is that small stomach size, especially in those first few days where the baby may have just, you know, in the first day or two, the baby's just eating colostrum. Tiny little bits of milk, like the size of a marble, is the size of the baby's belly. As the baby grows, yes, it'll go up to an ounce and a half, 2 ounces, and like I said, maxed out somewhere around 4. I'm gonna fall off the chair. But see that little bottle?
Yeah. I'm breaking things.
This is one of the smaller bottles.
This is a smaller. That's cool.
Yeah, and that's not. It doesn't look like a lot, but that's an entire feeding for a breastfed baby. So these big, giant 8 or 9 ounce bottles, to me, are almost intimidating for a breastfeeding mom.
And it also puts out bad information. It's like messing with your mind.
Yeah, they're meant for formula. They're not really meant for breastfeeding. So, good question. Good question. Yes.
So we've been asked the question. I've been asked the question before. I think if a mom is pumping but she's also supplementing, how do you mix the two together? Do you breast milk first? Do you mix them together? How do you make that work?
So the question is, if you are what we call combination feeding or combo feeding, that means breastfeeding with breast milk or pumping breast milk and also feeding formula, how do you make that work, and do you mix them together? How do you feed the baby with both? 2 reasons why you would not ever mix breast milk with formula. You would feed them separately, so you would start with whatever breast milk you're giving the baby if you're pumping, and then feed the formula separately in a separate bottle. 2 reasons. One is you want to make sure that the baby finishes all the breast milk. So if you mix them together and the baby doesn't finish the whole bottle, you're wasting milk. You're wasting your breast milk, right? The second reason is that breast milk and formula require different cleaning techniques on the bottles and nipples themselves. So where you would need to sterilize and keep those bottles extra clean with formula, you don't do that necessarily with breast milk. With breast milk, it's just hot soapy water or into the dishwasher. In fact, you don't want to keep sterilizing the bottles after the initial time out of the package. It breaks down plastics, and there's just no reason to do it. Breast milk doesn't grow bacteria the same way that formula would, so you can wash them differently. There is also a third reason too why you would never mix them together, and that's because when a baby eats breast milk out of the bottle, you can put it away. If they don't finish what's in the bottle, you can store it for the next feeding. So it's not ruined. which is completely opposite of when you're feeding formula. Once the baby drinks from that bottle and the lips touch the nipple of the bottle, the rest of whatever's left in the bottle needs to be tossed at the end of the feeding. So again, you'd be throwing out and wasting your milk. So never mix it together. That doesn't mean that if you're doing combination feeding for whatever that reason, whether it's a choice to do both, or if you are needing to supplement for extra calories or extra milk, you can do that, just keep them separate.
They're saying you should be there with us. Hi, Kate.
Sorry, I just had a mom ask about what features she's supposed to look for when she gets a breast pump. Like, I don't even know where to
What
start.
features to look for in a breast? We happen to have a pump right here.
We do indeed. Funny how that works out,
Funny, such
isn't
a
it?
coincidence that
My goodness.
we're going to talk about what are the things to look for in a breast pump. You know, if you're a new mom, if you're expecting, and a dad, if you're looking for a breast pump, they can all look rather similar. You know, just because they have a similar shape, they supposed to do the same thing. So really, is there a difference beyond the name or the color of the pump? And
I like that supposed to do the same thing.
they're supposed to do the same thing. I don't see that. They're supposed to, but they don't. They don't, and they don't always function the same way, and they don't always stay clean the same way. And so I want to make everybody a breast pump expert so that when they're actually choosing their pump, they know exactly what to ask and exactly what to zone in on and what to look at. So make it simple and ask these 4 questions or look at these 4 features when you're looking at a pump. The first thing always, and I've been starting with this feature because it's almost like that's how you divide them to begin with, is the system a closed system or an open system, right? And what I mean by that is, does it have a barrier between where the milk is flowing, and that's into that hole in the top in the flange, and the tubing that is connecting the air suction to the pump itself? This pump, the even flow pump, is a closed system, and that means that there's a barrier. So no milk can ever get into that little tubing, which is really, really hard to clean. It grows mold and bacteria and can contaminate. Yeah, it's hard to wash. And then it can also contaminate fresh milk later on when you're pumping into these storage containers. So always look for a closed system. Open systems have no barrier, okay? Second thing to look for is make sure your pump comes with multiple flange sizes included in the box. Not just, at the very least minimum that you can buy extra, but look for ones that come in the box. Like the one that we're showing here, the Evenflow, has 3 sizes that actually come with the pump. And the reason for that is that you need to have the right size in order to not have pain and to get the milk out. And when you don't know what size to use, it's not something that you can really measure. It's not like a bra where you're like, all right, let me just do my measurements and figure it out. You need to really try them, and so having it in the pump is really important. Third thing is independent
Speed and suction.
Independent speed and suction control.
And why? Why would we?
Because babies do not nurse at a phase 1, phase 2 like a lot of pumps have. And with independent speed and suction, you can adjust as you pump for multiple letdowns.
That's right, multiple letdowns. We like the sound of that. This is a good multiple letdown. This is in a good way, right? So that means that
Not like my romantic life. Multiple letdowns.
it means that your milk, you can get more of the milk out. And being able to stimulate your body the way your baby would to get that milk to flow. And when the milk is flowing and you're able to get it out quickly, you're going to be able to get more out, and that means that your supply will be better overall. So being able to control it yourself is super important. We don't want like any standard settings because not everybody works the same way. And the 4th thing is a battery option, okay? Make sure that the pump that you choose not only plugs in with an AC adapter, but it takes batteries. This one takes double A's right into the pump, and that way, no matter where you are, you'll never have to delay a feeding. You can pump. We have moms who pump, in the car, we have moms who pump where there's no electrical outlets or wherever you are. So, 4 features to look for. Any other questions? Do you have any breastfeeding questions? Breastfeeding and pumping questions? We're taking questions.
What about drinking like alcohol as a pumping mom or as a breastfeeding mom? How do you do both, I guess?
Good question. Alcohol and breastfeeding. Alcohol and breastfeeding. So this is a really common question that comes up because you've just gone through maybe 9 months of pregnancy. You're like, I want to have a drink, I want to have a glass of wine, maybe some champagne, I want to celebrate, whatever that is. And you've heard that obviously you cannot drink when you're pregnant. It is, and so I want to be clear about the difference between pregnancy and breastfeeding and alcohol use. So when we're talking about this, for sure, you're not drinking at all when you're pregnant. It's really something you want to avoid, and the new studies now are showing even more so that you want to avoid alcohol. It's a completely different thing. We're talking about a blood connection with a developing fetus. So we don't drink any alcohol when we're pregnant. But when we're breastfeeding, can you drink? And the research is showing yes, which was what we've known for a long time, is that if you wanted to have a drink, a glass of wine, or a beer, or a glass of champagne, you can do that. Because now we're talking about a milk connection, and it's an intermittent connection. That means it's not constant. There's time in between the feedings. And the alcohol will go into your breast milk, but it will also, over time, diffuse back out of your breast milk, so that by the time you feed the baby again, it's not there anymore. Plus, we've not seen with full-term, healthy babies any risks, even if there was a small amount of alcohol in the milk. What goes into your milk is really small percentages of what's actually in your bloodstream. So we're talking maybe 1% of what's in your bloodstream can get into your milk. That goes for other medications too. There are very few medications that you can't use or take while you're breastfeeding. So if you ever have a prescription where your doctor gives you a prescription and they say, okay, now you need to stop breastfeeding because you've taken this medication, the first thing you want to ask is what's an alternative medication that I can take, because I'm not going to stop breastfeeding, I'm not going to pump and dump my milk. What's safe? Because most medications are safe to take while you're breastfeeding. So yeah, good question. And I think that it's also one of the reasons why some moms decide they're not going to breastfeed, or that they're going to feed formula or going to stop early because they want to be able to have a drink, or they're on a medication, or they say things like, I don't have a great diet. Like, I don't eat that well, my diet's not perfect, so I'm just going to do formula, when really your diet really doesn't impact the quality of your milk very much at all. Even if you're not eating well, and I'm not encouraging anybody not to eat well, but even if you're not eating well, you're still going to make great milk. And so even more of a reason to keep on breastfeeding. There's a lot of myths around all of these things, and a lot of reasons why people give up on breastfeeding much sooner and discontinue earlier than they want to for misinformation about it.
Obviously.
Do you have any tips on how to make pumping at work or going back to school, how to make that pumping experience easier?
Tips on how to make the pumping experience easier if you're back at work or back at school. First thing is to make sure that you have a good pump. I mean, if your pump is not the appropriate pump for how long you're going to be gone from your baby, it's going to make things really hard. So that means if you're gone full time or many pumps, many feedings during the day, you want to make sure that you have a good double electric pump and that you're able to get the milk out, not just a hand pump or an occasional use pump. So having the right type of pump, knowing how to use it is really important. Making sure that the parts are fresh and clean and that they're functioning well, like the little membranes on the pump, those will can affect the suction on your pump and the functionality. Making sure that you're using the right sizes and that you're using the right settings. And also just preparing ahead. I mean, like making checklists for yourself, getting all your stuff ready the night before. It's just a lot to manage. It's hard to be a pumping mom and go back to work and think about what the baby needs and what you need. Some moms find that taking shorter breaks but more frequent pumping breaks while they're at work helps with getting enough. You know, like sitting there for a half an hour may not be the ideal, but doing a 15-minute pumping at work more frequently first can get possibly more milk accumulated throughout the day, and also will help to keep the breast drained so that you maintain your milk supply. Keeping frozen ice packs in a cooler so that, you know, milk can stay in that cooler for up to 24 hours in a cooler. So you don't need like a separate refrigerator. You also don't need to wash your parts in between every pumping session.
I was just about to ask if you really had that.
Yeah, I mean, it's a big one because you think, oh my God, I need a sink, I need a whole kitchen, I need like a refrigerator. You don't need any of that. What you need is bring your pot, get yourself a cooler, a little cooler. A lot of these pumps, like this pump comes with in the deluxe version, comes with a cooler and ice packs. Go to work with the frozen ice packs and pump into the little storage containers, put them into your ice pack, into your cooler, and in between pumping sessions, just take the parts, take the parts off, okay, like this, the pieces that are touching your milk, and just put them into a baggie and stick them inside the cooler from one pumping session to the next. Because the same way as milk is fine for many, many hours within the refrigerator or inside that cooler, so will the milk that's on the pump parts. Okay, so maybe you can rinse them, maybe you can't. Even if you can't, stick them into the cooler, and then with your last pumping session of the day, that's when you can go rinse them off, you'll take them home, and you have all your containers. This makes things just one less step. He's laughing at me.
I'm just tormenting you. I'm getting as close as I can.
Because it's unidirectional.
Yes.
We'll learn something.
Yes, unidirectional.
Unidirectional. Una or uni?
Unidirectional.
I'm not saying it wrong. Does that help? That's a good tip for sure. Any questions? Any other questions? Do you have a question for me? No?
How you doing? It's a long weekend. You know?
Next question, yes. No, go ahead, Elise.
Other than feeding the baby a bottle, what are other ways that your partner can help support breastfeeding?
Partners are essential when it comes to breastfeeding. And when I say partners, that can really be anybody that is supporting you with this. It could be your husband, it could be your partner, it could be your girlfriend, it could be your, mom, it could be anybody. But you do need someone to support you because breastfeeding is hard. It can be challenging, it's tiring, and you need someone's going to be your kind of cheerleader in it as well. But being able to hand the baby off after a feeding for burping, being able to have somebody else help you with just simple things like washing the pump parts and getting your stuff ready for the next day, or swaddling the baby afterwards. As a new mom, your real only job in the beginning, especially those first few weeks, is going to be feeding and taking care of yourself as much as you can. Sleeping, showering, feeding the baby, and then there's everything else that needs to be done. And I think that moms take on too much and think that they have to do it all themselves, and that's where partners can really step up and make a difference. And I think the other way that partners can really help is to get educated. Like people think, or parents think that it's mom needs to take a breastfeeding class, when truly, mom's going through all she's going through, and dad having the knowledge to be able to stand there and even support with latch and position and having some information so that they can be that person that she can lean into is critical. It's the most important thing. So all of the classes that I teach are for moms and dads, and it's usually the dads who love the class.
Moms and partners.
Thank you. Moms and partners. You're right. Thank you. Moms and partners taking the class, and it's because that's who's going to be able to stand there and support you afterwards. And I've had dads and partners who, after the baby's born and mom may be struggling with latch, it's hard for her to see.
You see things
exactly.
differently
You
from
have
here.
a different angle.
Yeah.
You have a different perspective, a different view, and the difference between a good latch and not so good latch could be just a slight tilt of the head. So that, I've seen it where dads will come up and say, just tilt the head a little. And then all of a sudden everything's fine. And it's from learning how to do it right. So you don't have to be a lactation consultant to help somebody be successful with breastfeeding. So leaning in.
Good for you.
When does mom know, or when do I know that there's something that's not really just a minor problem, but I should go get help? What are some signs to look for that there might be a bigger problem?
Signs that there may be a bigger problem with breastfeeding. Well, first of all, if it hurts, okay, it's really not supposed to hurt. And we say this, but then in the beginning it can be a little tender. Of course, you're having a baby go back to your breast, sucking on your breast, over and over again, and it can feel painful, but it shouldn't continue to be painful. Like the feet, sometimes right with the initial latch, it can feel a little sore, especially in the beginning, but it should not be hurting through the entire feeding. If you're hurt, if there's any pain, or if that continues on, you should get support right away, because again, those little changes in latch or position will make a big difference. Also, if it's hurting, there's a good chance the baby's not getting milk the way they should, that they're not able to actually drain the breast properly. So you want to make sure that you're getting off to the right start with that. If the baby is not wetting diapers, 6 to 8 wet diapers in a 24-hour period, baby should be hydrated and wetting diapers and pooping and all the signs of getting milk. But really, if you ever have any questions, I think it's good for, if you're concerned, the main thing is to really follow your own gut instinct about something. If you're concerned about something with the baby or with breastfeeding, get support. The best consultations that I do are the ones where I say, actually, everything's fine, and here's a few tips, and you're doing great, and they'll say, well, okay, so I guess I didn't need to come. Like, no, this is the best answer I could give you, that everything's really fine, and it's just a little more knowledge that you need to know that you're doing okay. So
what about, aside from like milk tissue and basic nursing, what about things like the boob flu, and like what do they need to look for, like clogged ducts and things like that?
Yeah, so there are some common things that can happen when you're breastfeeding, and that's like plugged ducts or clogged ducts, mastitis, which is what you're referring to with the boob flu. It's where you get an inflammation in the breast, and it can cause really high fevers and chills and make you feel really crappy. But those are things that are usually preventable for most moms if you know what to look for early. So making sure that while you're breastfeeding, you're kind of feeling the breast or feeling for any lumps or places where milk may be trapped. Getting milk trapped in certain areas is where those clogged ducts that we're talking about, they can feel like a lump underneath the skin in the breast, and not addressing it where you're using either moist heat, massage, frequent feedings, can then lead to things like boob flu, mastitis, right? Some moms are more susceptible to things like that, like plugged ducts, where that they could just happen and they're reoccurring. But for most moms, it's something to keep on top of, and frequent feeding and good latching position, as well as not putting too much pressure on the breast. Like what causes plugged ducts are either not feeding frequently enough or pressure in certain areas from things that you might not even consider, like wearing underwire bras. So many people wear bras that are either underwire or poor fitting, and that pressure from the bra can quickly cause plugged ducts in the breast, and that can lead to mastitis. So I recommend no underwire, especially in the first 6 months of nursing, is to stay away from underwire bras. As long as the bra is fit properly, you don't really need the wire to get the lift and the support that you need. Also things like purses or diaper bags. Wearing them on your shoulder in a certain way, you're not thinking about it, but breast tissue runs all the way into the armpit and also up into the neck here too.
So would that...
Then that could also be the same with some baby carriers.
Definitely.
Yep.
That was exactly what I was going to say.
Wearing your baby carriers that could dig into the breast tissue, diaper bags, sleeping on one side all the time, where you're putting pressure on the breast. Again, no one's saying don't use a baby carrier, don't wear your diaper bag, but if you are experiencing these problems, it could be that's what's causing it no one's really saying, oh, just stop doing that. You know, get a different kind of bag. Yeah. You mean like wearing a backpack versus, it all depends on where it's hitting the breast. You know, again, if the breast tissue is not, and some people will feel that they even get engorged in their armpit because there's breast tissue in the armpit. And I've had moms where it's actually pretty significant where they get like big lumps of milk coming in and it's in the armpit and all the way up to what they call the tail of Spence. This is the tail of the breast here. So there's more breast tissue up here too. This armpit area, it will be affected sometimes even more so from a backpack than even one that goes over your shoulder. So you got to put it on and figure out where it's hitting you. If any of them are you're having a problem with any of it, then start putting your diaper bag on your stroller, or you carry the diaper. That's even better. He's like, oh, okay.
Yeah.
What would be some reasons why the color of my breast milk changes and sometimes looks different?
Yeah, you know, with pumping, we now can look at breast milk. Think about it, like we were never supposed to see it, and when animals feed, they never see their milk, they don't see quantity, they don't see color, but now because we pump milk, we do see the natural changes that can occur from not only morning to night, so like sometimes your milk will be more bluish or clearish or yellow or white, depending on the time of day, but it can also be even more significant than that if your baby's having any kind of illness. Even before they're showing symptoms sometimes, the milk can start to turn colors where it looks more yellow, more concentrated. And what's actually happening is that it's exactly that. It is more concentrated, it's got more antibodies in it, it's got more of the properties that are going to help to fight the infection that your baby might have. And that will show up right in the milk. So what they've seen through research too is that it's not just that your body produces antibodies, but it actually produces it right at the breast level. That's how quick it turns around. You know, the T cells and all the things that are happening right at the nipple. So the baby goes and latches to the breast, and the milk comes out. But in between sucks, there's actually what they've seen through ultrasound is that there's a vacuum suction that's actually occurring backwards. So milk's sucking out, but saliva sucking in. And so saliva enters into the pores of the nipple with the bacteria of whatever that baby may be sick with, and the breast and the body immediately starts to create antibodies to fight that infection. And if you pump the milk right at that point, you may see that it's very yellow, totally fine. It can also sometimes take on colors based on what you ate too. So if you're eating certain foods, and it can show up in your milk. How much did you drink? If you don't drink enough water, you're saying, then you won't make enough milk. That's very true. If you're dehydrated, it will impact the quantity of your milk. So you definitely want to make sure that you're drinking enough water. But there's two sides to that, actually. Like, if you're dehydrated, you can decrease your supply, but it's not a method to increase supply. In other words, like if you're like, okay, I want to make more milk, let me start guzzling more water, I'll make more milk. It can actually have the opposite effect. Overhydration can decrease your supply. So it's a balance. It's a balance. You're not trying to take in just as much water as possible. You'll be thirsty. So you're going to drink to your thirst, and you're also going to drink to a clear urine color. Okay, I say that because sometimes you don't feel thirsty, or sometimes you're, more dehydrated than you feel.
Urine is the best way to know. Honestly, and I always joke, it's like if your pee looks like Gatorade, you need more water.
It's not everybody will make less milk, because of what they're doing. But if you're not making enough, the first question is to ask, am I drinking enough water? As far as eating, anyone who is underweight or doesn't have the fat stores on their body, their milk supply can definitely decrease by not having enough food or not eating enough calories while they're breastfeeding. But if you've got extra weight on your body's going to definitely pull from those fat stores to make the milk. So you want to eat healthy, you want to keep yourself healthy, and again, like I said before, what you eat is not going to have the biggest impact on the quality of your milk. Your body will break down every vitamin, every bit of protein, every calcium in your bone to make your milk perfect regardless of what you're eating, but you'll suffer for it. So you want to be as healthy as possible. Any other questions? No? Questions? No questions. Hi! Is this your first baby? Yeah, congrats. You walked up right at the right time. We're doing a breastfeeding and pumping Q&A. And so we're just wondering if anybody has any questions as they're preparing to breastfeed or preparing to get started, if they have any questions about it. She's like, do I have any questions? I don't know. Yeah, there's so many, right? There are so many questions. Oh my gosh, we have, well,
prepping to go back to work. Yeah, going back to work, like what to look for. And what?
How many times a day do you need to pump? Yeah. So in the beginning, you want to be feeding the baby at the breast, all right? And we'll say that we want to use the pump when we eventually get to pumping. We want to use the pump as a substitute for when the baby may not be at the breast. So babies will typically eat somewhere between 8 and 12 times in a 24-hour period in the beginning. So anywhere from 8 to 12 times. And it could feel like in the beginning that you're doing this all the time, but babies' bellies are really, really small. And that's what we talked about before. Small bellies, and breast milk is so highly digestible. It goes through them quickly. It's what we want. We want them, usually you put them to the breast and they're pooping as you're feeding them because it stimulates their body and making more room. It's the truth. So how many times you'd be pumping really has to do with how long you're going to be away from the baby and how many feedings you're going to miss, so that you substitute those pumping sessions for the times when you would normally feed. So if you're going back to work, say 3 months, whatever, after the baby's born, at that point you're going to say, okay, my baby typically eats every 3 or every 4 hours. I'm going to stay on the same schedule when I'm at work, so that way when I'm off, on my days off, I'm still on the same schedule. Your breasts know when your baby wants to eat. So like if you're on a schedule, this one used to freak me out. And when I was breastfeeding, is that I would wake up about a minute before my baby in the middle of the night, always. And I kept thinking, well, this must be a coincidence, but it's not. It's my breast kept waking me up. Like I would actually feel my milk get ready to let down because my body was so in sync of knowing my baby's about to wake up and feed. And so you'll feel those things. Remember that, Lauren? You know that what I'm talking about? Totally know that, right? Where you can feel actually it's time. So staying on that schedule with your baby is probably the best answer I can give you. And knowing how to use your pump so that you can do and get it over with quickly and efficiently. Yeah.
I've heard that you shouldn't wait until your baby's crying to offer them the breast or feed them. What are some early cues to look for in a baby to know that it's about time to feed them?
I mean, waiting for your baby to cry is a really late sign, actually. And so with a newborn and an infant, I would say that if they're starting to wake up, there's no other reason why they are, is that they're hungry. So as soon as you start to see them going from that deep sleep into a more active sleep where they start futzing around and they're moving and they're starting to smack their lips or turning their head to the side, okay, this is a rooting behavior of trying to look for the breast. That's what they're doing. These are all reflexes in a newborn. And
That little baby.
sticking their tongue out, making the signals with their tongue. All those signs, you will see that all subtly happening before they actually start crying. So waiting for the baby to start to cry is actually really late. Now you've actually delayed the feeding, and it can be really hard to put the baby to the breast when they're over hungry, when they're frantic, like when they're crying. It's hard. You've got to like calm the baby. She's nodding her head, right? So watching your baby for when they're starting to wake and going, getting ready, getting your glass of water, sitting down with your pillow, getting yourself comfortable, opening up the bra and doing all those things, and allow the baby to wake up at your breast. So sort of skin to skin at that moment, and allowing them to wake up at the breast actually stimulates their natural reflexes to latch. So they can actually go right to the breast and latch wonderfully when they're not so frantic and crying. Yeah. How old is your baby? Oh my God. So
fresh.
Brand new. Congratulations. Oh my gosh. Do you have any questions for me?
No, I'm loving the breastfeeding.
So good. Awesome. It's amazing, right? Oh my gosh. So beautiful. Congratulations. Aww.
That baby already has a good wig too.
So cute. So cute. Anybody else have any questions for us? Any breastfeeding, pumping, anything? You can ask us anything, questions. Yeah. How about you guys? Any questions? Jimmy needs to hold someone's baby.
Somebody wants me to hold a baby. I'm not holding any babies. Not today.
I'm so hot.
In a week or so, tell everybody what's going to happen.
Yeah, my best friend and his wife were about to pop, and that's exciting. And they came today.
And she's so cute.
Yeah.
They look so happy.
Guess what pump they're using?
We've had so many moms come by and talk about that they are using the pump, and they're
I had
happy.
a long talk with a lady today, actually. There was a lady I got chatty with, and she was like, I saw you last year, I bought everything you told me to, and I got the C4 pump, and it's great. I was like, game on. I'm good at my job.
It's so good to get the feedback and to know people are just really doing so well with it, and ultimately they're getting the milk that they need for their baby, and they're happy. It's the name of the game. That's what this is all about, right? Yeah.
What if I have to travel for business? How do I prepare for the airport? Is there anything I need to know
About going to the airport, if you're
traveling with my mom?
well, I would say you're about to do it.
3 hours.
You're about to do it. Well, I would say that if you're traveling with but first of all, take a pump with you on the plane. Whether that's a manual pump or even your electric pump with batteries. If you feel more comfortable, use you can even get like a nursing cover to use. I saw you doing that before with a nursing cover and pumping. The main thing is to you can read from TSA all the rules, make sure that you're aware. Breast milk is treated differently than other liquids, so if anybody tells you you need to dump your milk, please question that. That's not true.
It's just like with car seats, print everything you can and keep it in your bag.
Because you could get someone who really just doesn't know what they're talking about, and that's the last thing you ever want to do is dump milk. Yeah, but make sure you just like. Oh, really? Yeah.
They do that. They were there to
Oh God. Yeah, they don't get to taste it or make you taste it.
Oh, bless your heart.
I think as a more general answer to that, it's really anywhere you are, you have a right to breastfeed or pump your milk. And no one can really stop you from doing that, nor should they. And if someone is telling you not to do that, you have rights to be able to nurse your baby or feeding your baby. And don't ever allow anything to put off those feedings. Like, make your baby come first. That's your priority. You know, if people are around, and this is, on a really common level, the most common time this happens is usually right after you have the baby. People come to visit, you have lots of visitors, and that could make you feel like, okay, well, I'm going to keep waiting to feed. You need to either nurse with everyone around or make everybody leave and have that time with the baby. There's nothing more important than those early days of making sure you're not delaying those feedings, for sure. Hi. Good, how are you? We're doing a Q&A. Do you have any questions? Breastfeeding, pumping, anything? No? Okay, just listening. Congrats. What do you do? Looks like that. So many pregnant mamas.
I need to check time. It's 3:10.
Are we done?
That was an
Yeah,
hour.
we're done. Oh my gosh. Okay, yay, we're done. Woohoo.
I have to get over to another live stream now.
Bye guys.